So when preparing to repair a laceration, the first thing you want to do is remove any large debris and contaminants, irrigate the wound and cleanse it. You want to cleanse it with an antiseptic solution. Could be betadine depending on patient's allergies. And then you also want to prepare everything. When preparing your sutures, you want to use the smallest size suture possible for the tissue that you're repairing. Sutures come in your monofilament as well as a multifilament. Your monofilament is going to have less likelihood of getting infected, but your knots are not going to hold as well. But your multifilament is going to have a increased chance of becoming infected, but your knots will hold a lot better because it does have that braided feature. When thinking about suture size, the numbers on your suture 3/0 versus 4/0, your 4/0 is actually going to be a smaller suture compared to your 3/0. Once you are prepared and have all of your sutures set up, then you do want to let your patient know that you're going to inject a little bit of anesthetics. Typically we're going to use lidocaine 1 or 2%, and we are going to just cleanse it very well on the wound site itself, but also around in the surrounding tissues. And we want to go bevel up and inject right up under the skin. And the whole time we're going to be injecting little bits of lidocaine. As we move out, we're going to inject around the tissue, around the wound, wanting to try to limit the amount of punctures, but also provide that anesthetic for the patient. You want to be careful not to use lidocaine with epi in areas that you have to worry about decreased blood flow, so the digits, the tips of the nose, that type of thing. So we're going to get the anesthetic, the lidocaine, a little bit of time to work. So once we give it a little bit of time to work, we can actually ask the patient if they feel us touching. It is normal to feel the sensation of someone touching you. However, they should not feel anything sharp. You ask them, do you feel anything sharp? And once they don't feel anything sharp, then you can begin. So to begin with, you do want to get your sutures. And you can use your pickups to actually get a good grasp on the tissue itself. You want to enter in at a 90-degree angle with your needle to make sure you're getting the dermis and the epidermis. So we're going to do the interrupted suture, single interrupted suture. This is going to be appropriate for most simple wound closures. There are different types of closures that are sutures that you can use for more complex, like your mattress suture and all. But once you're doing this, you want to make sure that you get a good knot. So we're going to wrap around twice and then pick up just to make sure we get a good knot. At the same time, you don't want to pull your sutures too tight that we have to worry about a skin flap, but we do want to make sure that it is well approximated. Our wound edges are well approximated without overlapping. And then we're just going to cut the ends. We want to ideally get all of the knots to the same side. And then again, we are going to make sure that our sutures are spaced appropriately far apart, that we're not bunching them up, but at the same time we're not having gaps between the wound edges. I'll leave a little bit of a tail for us to grab to create our knot. Again, twice around. And pull around to create a good secure knot. So the amount of time that sutures stay in place is going to be dependent on their location. Your locations that heal a little bit faster, such as your eyes and your eyelid, those are going to stay in place for approximately 3 to 5 days. Your areas that take a little bit longer, so your face, your neck, we're going to keep those in for about 5 days. Your upper extremities and trunk, they're going to be about 7 days. Your lower extremities, they're going to heal in approximately 8 to 10 days, so a little bit longer. And then the palms of your hands, the soles of your feet, that's actually going to stay in place for about 10 to 14 days. So it's important to let our patients know what the expectation is of when to come back for suture removal. You do have 2 different types of sutures, your absorbent and your non-absorbent. So your absorbent are going to be like your Vicryl, and they are going to essentially dissolve on their own. The body's going to break them down. You're going to use those a lot of the times in like the mouth or in deep tissues. And then your non-absorbent are going to be more like your silk and your Ethylon, and these have to be manually removed. Which are a good thing as well, because then you don't have to worry about the body breaking down the sutures before the wound is actually healed. These will be manually removed. So again, at any point, if the patient does complain of feeling anything sharp, we would reassess the need for more anesthetic. And we do remember this is a sterile procedure. We would have sterile gloves on. So most wounds that are being repaired don't require prophylactic antibiotics. However, certain ones in certain areas, such as the nail beds, that are easily contaminated or at a higher risk for becoming infected, might require prophylactic antibiotics. Same thing with human and animal bites. If they needed to be sutured, then they might need a prophylactic antibiotic as well. So we just want to make sure we have good wound closure without any gaps. Some home care instructions. We also want to make sure we let the patient or their family members know, especially if it's a pediatric patient, is to keep it covered for the first 24 hours with a dry, sterile dressing. After that, you can leave it open to air. And then don't submerge it into water, especially if you're using absorbent sutures. But you can use gentle soap and water and just pat it dry during routine showering. And then make sure you do follow up in the appropriate time given based on where the wound is located to ensure that we get these sutures taken out. So we want to make sure all of our knots are towards the same area. All of mine are towards the top, and make sure all of the edges are cut down. Also want to make sure that the patient and family members know signs of infection. So if they start noticing the wound site being angry and red, tender to the touch, hot to the touch, or have purulent drainage, then they want to give the office a call or come back because that might warrant further investigation.